Good evening to all my subscribers. Today we're going to continue to talk about more of the evidence-based practice. In the previous video or previous couple of videos, we talked about some meta-analysis error and how that jeopardizes a patient's treatment outcome. We also talk about a lot of error that in regarding to the treatment as a clinician approach to the different type of mental illness patient. Today I want to continue to move on with different type of strategy to support our client, and let's begin with clinical practice guideline (CPG). It is representing a systematic approach of translating the best available research evidence into a clear statement, and we can use that statement to predict and diagnose different types of health condition. Why I want to discuss about this, because a lot of clients, when they come to the clinic, they don't really necessarily just have a mental illness. They do develop a lot of different type of clinical, rather clinical difficulty, chronic health condition, and that kind of either is separating their mental illness or make them feel worse because of those difficult physical condition and plus their mental illness, and can create a difficult treatment goal for the client. So as we talk about the best available research evidence and how we're going to implement the available research evidence into the practice, that could be a very challenging one. So that's why we're trying to utilize CPG, clinical practice guideline, to support our finding and support our research on how to support a client in the long term. So we can utilize those things to arrive at the best decision and consistency with patients' previous diagnosis and their preference and value. We can utilize to at least make some predictable treatment outcome for the client, and also help the client on choosing the type of treatment option they want to do. It's benefiting for them in the long run. That's why it's called part of evidence-based practice. And then we can also utilize those formulating questions, asking client to find out if there's any selective outcome. And we can also use those selective outcomes to support our study on creating the evidence profile of the client. So those are very important, and make sure to include a summary of finding on the estimated impact for each different treatment outcome. And we also talk about maybe including the rate quality of evidence on each outcome. Maybe those things you already studied on your master degree program, but we can rank those people into the risk of bias, inconsistency, discuss about if a large effect of error could jeopardize the treatment result. And of course, those response and collaborate with different type of treatment can provide some sort of outcome, or at least preferably provide some of the more accurate outcome for you to treat your patient or your mental health client. And I also want to including some sort of a recommendation on what they need to include on your study or when you provide your treatment to your client, such as value of preference, acceptability, balance of benefit, resource use, and quality of the evidence. So all those things are quite important. So when you're doing all those study helping your client, you have to including all those type of practice and clinical evidence on your study. And when you support your client, you also have to including all those available resources to provide the most accurate treatment for your client. And some guideline to develop a better treatment, I would say maybe provide a comparison between your previous treatment outcome to your current treatment outcome, and make that prediction for your future treatment outcome for your client. Manage your CPG, make sure that those CPG are in the way of when you're doing the clinical study, and you can compare or see if some treatment outcome will work for your client. and establish transparency. Ask your client to be honest about the treatment outcome. Ask them to see if the treatment is effective for them. Find out if the medication working. Find out if the dosage level is working, and help them to balance out. They may give you some suggestion about how to support themselves, right? And there's so many titled review that you can do. You can strengthen your recommendation by provide more evidence on your treatment. You can also figure out other systematic approach on supporting your client. Well, hope today's video will give you some guideline and support on how to utilize all those different type of strong evidence-based research to support your client. If you have multiple clients have some difficult issue, their mental health concern, feel free to utilize all those treatment and concern and make sure that all the treatment are working for your client. And I hope the video can really help you. I will see you at the next video. Thank you for continuing to support my channel and watch my video. I do hope you have a good evening. Bye bye.